excited to be here.
They're gonna.
Hello and welcome to Journey Through the Eyes, the EMDR podcast that is here to unveil and explore the transformative power of EMDR therapy. Our mission here is to support both the new and seasoned clinicians with those critical conversations, resources about EMDR. Therapy and building your incredible private practice. I'm one of your hosts. My name is Tamera J. Brown. I am an EMDR consultant in training, and I have with me my amazing co-host, Miss Kathy on the couch. Kathy, introduce yourself.
Yes, Kathy Couch here. I'm with Rewired 360 out here in Twin Falls, Idaho on Friday. It's so awesome. And we are so excited today to have our guest here, David Polidi. David reached out to us and put together a podcast summit conference meeting with all the EMDR podcasters. That's how we met. And he's going to be part of our mental health summit coming up in May. So we're going to be doing a series on all of our mental health, our guests for the mental health summit. And so we're happy to have you. David, I'll let you kind of introduce yourself.
Great. I'll start by saying thank you for having me here. It is an honor. Um, I love you guys. It's been so much fun. It's been a really interesting journey and ride. We had the other podcast, so it's so nice to be back on this podcast with both of you. And we had that, I like to call it a party, where we had a party with five, what was it? I think it was five of us. No, maybe more. It was a whole bunch of us, nine of us, that all got together and started to talk and dive into the magic of EMDR. And now with the summit and being able to be a part of it, I am super excited to
Mhm.
talk about my love of EMDR. Of course, you know me, I'm going to bring in IFS into the arena. And it feels so relevant to be talking about
Mhm.
burnout. So I'm so excited to be a part of that and start really kind of thinking about what is this thing that we're calling burnout and how do we help each other get through it and feel better?
We had a few questions here for you. We're just going to be kind of going through all of um, the questions here. Can you talk a little bit about what it was like creating your proposal and what that was like for you, and just going through all that information as we're working on this podcast today?
Sure. Well, I got this email from from you, Rewire 360, and I said, "Oh my gosh, what is coming in now? I love these emails." I raced to read it and saw that there was something for the first time ever, I believe, that you're putting together. That it was sounded so exciting. It sounded like you were going to bring together a bunch of us that love EMDR and to talk about how can we help one another to deal with burnout. And so for me, I'm all about integration. I'm all about coming together. I'm all about community. So I said, you know what? I got to throw something together. I got to see if I could offer something to this. And I figured, what if I just do IFS, EMDR, and bring that? And so you wrote back to me and said, is there a way that we could shift this to really address burnout? And I thought to myself, yes, I'm going to figure that out. Went to ChatGPT, help me, ChatGPT, and then started really thinking about it, really thinking about what would IFS informed EMDR say about burnout? How would it deal with burnout? And then, of course, I had somebody, as the universe gives us gifts, I had somebody that is an expert on burnout in my podcast. And so I was able to talk to her. I was able to explore her role in burnout. Right now, on a little side tangent. And if you want to dive into this, we can. If not, I totally respect that. In my podcast, this is the second season, and I want to do something fun and a lot of things for me are fun. One thing that I love is watching TV and watching Netflix and watching movies. So I thought, what if I ask people, and I ask my clients this all the time, what are your favorite shows? What are you watching right now? What movies mean something to you? And then if we deconstructed it with IFS and EMDR. So
Mhm.
when this wonderful woman named Jen came on my podcast, she's talking all about burnout. And we had talked before the podcast, and I had asked her the question. She said, right now I'm watching Severance, which I was sort of familiar with. And I do love the show. So I thought that would be really cool. And if you are you both familiar with Severance? Oh, okay.
No.
Very, very quickly. It's about a company that has been created that has found a way to separate out the part of you that's working from the rest of you. So that people go into it knowing this and sign up for it, then they have some kind of scientific thing happen to them where they then have what's called an innie who is at work at the end of the day, goes into the elevator, doesn't remember anything. All of a sudden it's morning and they're back at work and they're always at work. And then you have an Audi who does the same thing in reverse, where they go to work, go to the elevator, and then they don't remember anything. And at the end of the day, now they're done and they live their life. So there's only a work persona of you and then a out of work persona. And there's different reasons why people join this. It really centers around the innies and their experience and how ultimately, I believe in season one, they're trying to escape. They realize, I don't want to be here. This is a trap. And they're trying to find their backstories of what brought them there. But it's such a great analogy of parts
Wow,
and
that's
how
so
when you're
cool.
having, yeah, and when you have a part that's just working, what's going to happen? They're going to burn out. So, been discussing it, we kind of brought it into this discussion of how this TV show was a really great example of some of the things that we're looking towards when we're talking and discussing burnout. And so these parts, that became their life. That's all they cared about. That's their own reality. That's all they knew. And when we get sucked into our work, maybe to that degree, but when we get sucked in where it starts overtaking and encroaching on everything else, that's the road to burnout.
Mhm. David, I think you're sharing something that is such a needed conversation. I know that, the talk about burnout and um, we're having more traction, right, with EMDR and IFS. And it's a beautiful thing to see these therapy approaches that were once kind of looking at as they were kind of woo-woo, right? But now people are learning more about them and everything. But with all that being said, I think you're leaning into something that Kathy and I have been talking about all year, which is how the healer and the helper needs support and help and needs to take care of themselves because it's no secret, right? We know that all of us in the helping profession, whether we're therapists, nurses, teachers, wherever we are, and we are supporting others, especially in the healing arts, right? That we are giving so much of ourselves to the people we are serving. And it's like, there's no way to not come into contact with other people's pain and the work that we do. And I think that is what that is the conversation that we have to lean more into, David, if we will, because I think some of us, we're doing the best we can. You know what I mean? We're doing the best we can to navigate, be with folks and everything. But just the reality that for us as healers and this idea of burnout and all the things, I think this is a beautiful conversation because we get to support the helping professionals and recognizing their own humanity and saying that you are coming into contact with the weight and the complexity of your client's pain every day that you're
Yes.
working,
And can
right?
I take that to another level here?
Mm-hmm. Mm-hmm.
I love what you're saying. I always do. And you're right. You're absolutely right. And I feel like this other thought that I've been playing with is that I feel like burnout is almost on a spectrum. And
Mm-hmm.
we all have some level of that burnout. And it might get bigger some days, smaller some days, but we all do have it because of the very factors that you're talking about. I also feel, and this is true particularly in our field, there's shame around burnout. There's judgment, there's feelings of, oh no, I can't do that because if I was a good counselor and I'm telling every or therapist, I'm telling everybody all these wonderful self-care skills, how could I not be doing it myself? And so then you're carrying the shame, you're maybe hiding it, the feelings that you do have when you do feel burned out, which only leads to more burnout. I think what we're doing, and I give you both credit for kind of putting this together and organizing this, is we're giving people permission to really have compassion for themselves, to say this is normal, this is natural, and how could we accept it, love it, and work through it together? And the person that I spoke to, there's so many things to share. The person that I spoke to said something to that extent of, what if we're able to look at our feelings of being burned out, and what if it's really our way of communicating or trying to communicate to ourselves that the environment that we're in is beating us down, or that things in the environment are leading to this burnout. So I really see the burnout as a message in addition to a call that we need to figure out how could we relieve some of these feelings that is bringing up inside of us.
Mhm. David, when you said that, you know what came to my soul? It was Viktor Frankl's quote. And oh my gosh, is my heart so full right now for us as a healing collective, as the healers who are a human family and a collective. And Viktor Frankl said this: what is to give light must endure the burning.
Wow.
Okay.
Wow.
That which is to give light, that which does give light must endure the burn. And I love how you validated the fact that well, in my hearing, it's almost like we can begin to gently and humanly just accept the fact that burnout is not that we're going to not experience it, right? But that we can embrace it as a part of the journey that we do in this thing we call life, not only in the work we do, but just as human beings, period, right?
Absolutely.
Mhm.
I'm gonna go energy here for a minute and just think about, we're always giving this energy, 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 and having a real clear connection with what fills us up, as therapists. I think that's kind of the mission here is to go energetically. So even if we're not doing anything, self-care, what is it? Self-care doesn't have to be anything huge. Like I went on a retreat in Guyana for 5 weeks. It can be drinking out of my favorite cup, using my favorite chapstick, taking a breath in my car. It can be just these small things. And so I think these things are very important as we're talking about burnout, doing these daily practices that can become rituals so that we can prevent the things in our future that cause us to have these symptoms that are distressing, right? And so sometimes, one of my questions is, what would you recommend to a new therapist to strategies to implement as a new clinician to prevent burnout? What would you say to a new clinician? In the field, we have our capes on, and we're in our first session with all of our CBT books. I'm going to do the CBT. Wait, I'm doing DBT. Wait, I'm doing what am I doing? What would you say to them as for self-care?
Yeah, I would say to them, first of all, let's normalize what you're going through. And let's see how we all have this. And it's nothing to be ashamed of. And let's see how we could connect. Oh, look, there's something coming up June that is being put on. It's a summit. And I would say, I think it would be wonderful for you to go to the summit. You're going to hear some really interesting speakers, and we're going to talk about burnout and self-care. So I would say to go to the summit first. I I have a lot of thoughts about what you're saying, and it leads me into some of my presentation. think backing up to answer your question, a concrete thing that people could do, in addition to what you're saying, is, it could be a small thing, drinking from your favorite cup, going to Dunkin' Donuts is mine, whatever it is. I think I love to call out a great Buddhist monk, Thich Nhat Hanh, and how he is all about the mindfulness of every moment. So we're not going to be mindful every moment. However, if we realize that things are feeling heavy or feeling like they're attacking us, we can just take a breath and connect to our body, connect to what's going on, maybe go out in nature and just be very aware. In that way, we become an observer to what our emotions are. We take a little bit of space and we say, could we just identify and describe what it is that's going on in our body, what it is that our mind is wanting to think in this moment? And I find for myself that's a really nice first step, just to see where I'm at and to ask myself, what is it that I'm needing in this moment to feel a little bit more grounded? And then the answer comes uh, in what would help me to feel more connected to myself, to others. Now, what's interesting is that I'm guessing that if you're in this field, and even if you're not in this field, if you talk to any therapist ever in your life, you have a list of things to do. If you don't, go buy or go on the computer, check out DBT. I have a DBT book. It has 200 things that you could do. So there's no shortage in what you could do. I'm guessing we all know what to do. What I'm going to be talking about is IFS, EMDR, and self-help and burnout. And so my question really goes more to what parts are holding you back from doing the self-care when you're feeling this way? What are they trying to say? What are the parts that are really stressed out? What are they needing to share with you? And if they do have concerns because they want to say something or need to communicate something, they're not going to want to be silenced through self-care. They're going to want to get out. So I totally believe in self-care, and I think it's amazingly important. And I think to do it more effectively, we also have to be aware of all of our parts so that all of our parts are signed up to do the self-care strategy. We can't hear you.
You said some really amazing things there. So, on one hand, what I heard from you was the invitation for us as therapists, whether we're new or seasoned, to really, and this is, man, to not only go to school, right? And we're on that grad school journey, and then we get introduced to all of these different, what I like to call healing pathways. We can travel with our clients through DBT, CBT. There's so many approaches that we can use in serving our clients. But what you invited us into is don't just learn the model for your clients, use the skill for yourself as well. And isn't that a fabulous call? Right? Isn't that a powerful work that we're no longer just going to school to get tools, but they also become skills for us to use in serving ourselves as much as we possibly can. And then I want to ask you because
Could I
there's
say
so.
something to what you're
Mhm,
saying?
mhm,
And I'm
mhm.
sorry, slow it down. Um, so when I got into IFS and I really started understanding the model and loving it, I really found that there were some incredible people in the community, and they made IFS a way of life. They said, I will check in with my parts every day. I'll talk to them. I'll have a relationship with them. When they're stressed out, I'll show them I'm there for them and I love them. And it's been a more recent thing. And it's with both of your help as well and some amazing people in the EMDR community. I think we could do the same thing with EMDR. I think it's more than just a tool, more than just a strategy. It almost becomes a way of seeing the world, and it can become a way of life as well. And so when we take these things on as almost like to me, I don't know if this feels right to others in the audience, but to me, it's almost become sort of religion where I feel I'm going to use these skills in my life to help myself get more grounded, to help myself heal, to help myself connect. That's where the power is. And then when you're sitting with somebody doing EMDR, as notice that community says a lot, which I completely respect and agree with, is then it really becomes this journey where you're on it together. And it's about the connection, it's about the space in between the two people and the inter and intra subjective space that
My
is
goodness.
created. And so
Mm.
we actually just to, I'm just sharing with this as friends, as you both my friends and the audience is my friends. I recently talked to Notice That on their podcast, telling them my whole journey this year. And so we decided let's talk about shrinking. So it's not published yet, but we're going to be talking about the intrasubjective space that we could see within the TV show Shrinking, which is just so much fun to go into that realm. But in order to do that, you need to be aware as a therapist of yourself so that you're able to bring in that calmness, that awareness, and help if the client is feeling really activated, really upset, to be able to allow them to tap in. This is more from IFS, but perhaps I could say it in an EMDR way, if this makes sense. Almost to tap into your AIP so that that could help them tap into their AIP.
Oh, David, loaded, right? I mean, just so loaded because Kathy and I have been talking. I don't know, it's been like about 2 years since we've been on this journey. And I shared with her, I said I was in a training with a Gestalt psychologist from Mexico back in
Yeah,
2015.
I'm still waiting for the name. You were
I don't
talking about this person.
remember.
What is the name?
I don't remember his
It's
name. He was just
Monte.
no, not Gabor, not Gabor Mate. It was another gentleman. He was from Mexico and he was a Gestalt psychologist specifically, but I cannot remember his name. And I mean to tell you that man came
So
into
to this man, if you're in the audience, if you're listening,
yeah.
call in. Please let us
We
know your
we
name.
had him, we had him. I was working at the San Antonio Council of Alcohol and Drug Abuse, and it was just a CEU training, but he came in. Oh my gosh. And he said to us, he said, if you're a therapist in the room, he said, know this today, before you were ever called and given these technical terms of being a therapist or a clinician, he said, in ancient times, the people knew you as the healers. And he said, and it is time for us to embody that. But that also meant, David, exactly what you're sharing with us, right? And everybody, I believe this, and this I don't know how it's going to go over. Many are called to this field to do the work of the healer, but there are a few who are really chosen. And the people I believe that are chosen to do this work are those who are sensing and hearing the call in that magnetic pull to allow not to just do the work, but to become it and live it as a lifestyle. Because from a polyvagal theory, right? One thing you said that, ooh, this is juicy. One thing you said, right? And you were talking about how when we regulate ourselves, in other words, right, our therapeutic, our healing presence is what helps to set the tone to help our clients to also begin to regulate themselves. Talk about the vagal nerve. Right? Because we know through polyvagal theory, we're only as well as our vagal nerve. We're only as well. We only feel as well. We only are as well as our vagal nerve, right? And so if we can adapt, not just do the work of therapy, but live the life of the healer so that we can bring more healing into the lives of our clients in the world around and hold some of that light, hold some of that wellness also for ourselves, right?
Yeah.
Okay, I'm gonna go in all of this. So we have this so we have intrapsychic and interpsychic. So
Subjective. Or are you,
I'm
I'm
just talking
sorry.
about those two terms. So intra between is between me and you, and I forgot what inter is, something different. But intra is the dynamic between me and you and the facilitation of that process. So as we're looking at our own resources, we have to have our own resourcing on board to your point of the AIP, so that we have our own work to be able to give. So when we're in a dyad, right? We're in a me and you therapy session, and, we have to be turned on and tuned in to be able to have this, what I'm going to go energy now, energetic exchange. If I'm vibrating low and I don't have it to give you, then you're not going to receive the full amount. But if I'm doing things that make me vibrate high, those sessions are the most magical. I just did a little TikTok with Katy Perry from the Grammys, and it says, what it looks like when an EMDR memory is fully processed and she's just about to push the button on the computer and she pushes it and it goes, wow. It's like, oh my God, that's how it feels when a patient transcends in therapy, and that memory that you were so scared of is processed, or you learn a new EMDR skill. And it's like we have to have both of those on board. And I think to my point, another point is we have systems. I worked in a hospital system and they were like, you need to see 32 patients a week. We're on the 45-minute schedule. Boom, 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 boom. And at that time, as a newer therapist, I was like, okay, I'll do that. That's no problem. And what I would say now to a new clinician would be, it's okay to set boundaries and limits of this is too much. I'm not able to do that. Or is this system something I need to be a part of? And that was one of the reasons why I chose private practice, because I have 3 children, 2 of them are twins, and it's like I need that time to be able to also, again, to your point of the parts, have time, mommy parts, times for them. We're not just parts in therapy, but we also need other different parts of us that need to come forward for different things. And so that's kind of how I had my journey. I was like, I don't know if I can do private practice, but my life, what's going on in your life? I would encourage you to consider that. And then what are your goals? I didn't come, to be a new therapist to be like, I'm going to have a private practice. I'm going to do Rewire 360. I'm going to, change the mental health landscape with EMDR. I didn't know that. And so just kind of to your point of knowing it's a development process, right? Like you with IFS, still you have so much to learn, but we have not arrived. We still need to keep that moving forward and going, and understanding that energy dynamic can bring our resources on board, so we can do what I call spiritual healing between us, so that my guides resources are all coming forward, and then theirs together in that moment, instead of them just having their resources and their resource team of 10 and mine of 10. Now we have 20 for both of us. It's like, oh, this is so cool.
Mhm. I love this. Can we do something? Because I know Kathy and we've spent a lot of time on the Journey Through the Eyes podcast talking about EMDR. David, for people that may be, in my community or in other communities that may not even know about IFS, and they're probably listening like, parts, what are parts? Can you, in a simple way, help the folks in the listening audience to understand what are parts and what are we meaning when we talk about parts and IFS?
Yeah. So I was thinking about this podcast and I'm thinking about my training that I'm going to do coming up with you. And I'm wondering if how does this hit both of you? Um, Within the class in IFS, there's a lot of demonstration and there's a lot of practice. And when I've heard other people talk on podcasts or elsewhere about IFS, they sometimes just dive into, let me show you, as opposed to just explain it. And since I know both of you, I feel really comfortable with both of you. How would that feel to you if instead of like describing it with words, I just show the audience?
That's great. I think it's all about the experience. It goes in line with my view of EMDR. It's like it's an experience. I can sit here and tell you, and we had that. I did that with Wes Wingett in the Adlerian therapy once, and that sticks in my mind more than anything he said. So I think that's amazing. The experiential, like I can just tell you about EMDR all day, but until you have the experience, you're not going to really get it. So I'm on board. I don't know. I'm going to shift it to Tamera, but.
I'm definitely on board.
Okay, who would like to be a volunteer
I'm
for it?
down. You want to do
All
it right
right. Yeah,
now? Oh
if you
shit.
want to.
Okay.
Does that feel okay?
Yeah, I'm great.
Great. Okay, so I was thinking, and it doesn't have to be this, that it could be interesting if, per this discussion, you think about what comes up inside of you, specifically around self-care and around burnout, and just to look inside and see if there's any parts of you that are coming up that want to be spoken for. We could welcome all of them. IFS is great with taking time, saying we have as much time as we need. It's really not about thinking and creating and formulating in our thinking part of us. It's more about creating the space and really noticing, similar to EMDR, really noticing what do you feel in your body? What comes up as you think about Kathy's self-care?
Yeah. It's like I'm more of an imagery, so it's like a healer, right? And she's putting salve on the wound and just going over like mine's my chest, and so she's just like rubbing it and putting the salve on it and putting the bandages over it, with the tea and the herbal tea, and someone's rubbing my feet. It's like you go into a tent, those healer tents, and you're sitting down. It's like I've brought you to the healer, and so they're just sitting there doing the works on you. That's kind of what I
I
see.
love that. I love that. So check inside,
Yeah.
open the door for
Okay.
this healer,
Okay.
and see if she's willing to. I know we're on a podcast, we're being recorded. See
Okay.
if she's willing to show up inside of you. See if she's willing, if we kind of create that invitation.
Yeah.
Could you feel her
Yeah.
present?
Yes. Yeah. Mhm.
Where do you feel her in your body?
All in my heart.
Ah,
In
beautiful.
my gut. Some of my gut, I'm saying. But as I'm scanning right now, I'm going, yep. It's all like,
How do you feel it? How does it show up in your heart?
it's like a swirling ball. And so it's like, oh, like, there's a lot of activity, I guess is what I'm feeling. And then like she's just there to like calm the rotation down, if that makes sense.
Okay.
Like behind
Yeah.
you,
Does
like
it make
that
sense to
image
you?
behind you, yeah. Oh yeah, of course. It's like that, how do I feel? Just give me a second here.
Take all the time you need.
It's like a serenity, I guess, if that makes sense. Like she's there, but like she's just telling me like there's nothing you have to do. It's all okay. You matter, right?
Yeah. How do you feel towards her?
Oh, it's just like I mean, you use your word for your business, but like empowered compassion, like safe, I feel respected, I feel heard, I feel seen, I feel just kind of like you just take a big breath, like I'm just seeing like right after a car accident or something major, you just take that big breath and you're like, you get a hug from a friend. It's like, oh, I can just rest here. I don't have to do anything. They're just gonna rub my feet, give me a
So
blanket.
it appears like she has a lot of self-energy qualities
Yeah, you
and
can
she's
tell
very
me
powerful.
what that is, a self energy. Tell me about that.
Self-energy is not a part per se,
Okay.
but self-energy is what all of us have inside of us when our parts are able to relax back.
Okay.
So when our parts relax back and we're really just centered in our heart,
Yeah.
that is an element, an energy which the founder of IFS describes as having 8 C qualities. So it's 8 C words of courage, curiosity, compassion, creativity, connection, confidence, calmness, and clarity. And so as you're describing this energy right now, there feels to be a lot of that calmness, a lot of that compassion,
More of
and
the connection. I think when that resonated with me was like, I'm seeing she's taking care of me. that connection part is more for me because I can
Oh, okay.
regulate my nervous system, but I need other people.
I love that. Now, what differentiates self energy
Mhm.
from a part is that parts want to do things. They have an energy where they want to help, they want to heal, they want to change. They're mad, they're angry. They sometimes they do crazy things that are, not that pleasant. Whereas the self just is, could just sit and just be.
Yeah.
And maybe if you ask this, the healer,
Yeah.
is there something that she wants or needs from us, from you? And is there anything she wants to say?
Um, it's okay to rest. You can take a nap. There's also like a little guard around, like I'm gonna keep all the people away so you can do this work, if that makes sense.
Yeah.
So it's like somebody that's around like a lion circling the tent, like I'm just gonna say it. Bitches better not get in,
What if we turn to that lion
Mhm.
and see how that shows up for you?
Yeah.
That would be in IFS terms a protector. So
Mhm.
there's, in addition to self energy, there's different types of parts. So a part of us could be more of a defense, a protector, something that wants to keep us safe.
Mhm.
And then we also have these inner children or these exiles inside of us that they're guarding. So see what that lion is. See if that lion would communicate with you, if there's anything that lion wants to say. It sounds like that lion, she's doing a pretty important job.
Yeah. It's a male. It's just like looking out on the meadow, like in Lion King, where you're looking out on the meadow scanning for the threats. And it's just like, I'm putting you all on red. Like, I see you all. I just got a shirt that says EMDR therapist. I see more and know more than you think. So it's like
So if the
that.
lion was wearing a shirt, would that
Yeah.
lion be wearing that shirt?
Yeah. Yeah.
Nice. Is there, if you go to that lion,
Yeah.
how do you feel towards that lion?
Oh, just like it's different. Okay, give me a second. Uh, It's not like the same sacredness as the healer. It's like we have a relationship, but it's not like a knowing, I guess, per se, because we're two different people. Like it's a part of me, but like it's not the essence. Like with the healer part, I'm like kind of more aligned with the healer part because that's more of who I feel like my essence is. But like the protector, like it's there and I can access it, but it's not like my true soul, right?
Yeah. How do you feel towards it in terms of just your feelings? It sounds like you're appreciating the fact that it feels like a part. I think when we talk about parts in IFS, this lion feels something that I would attribute to is a part of you. Um, and then we just look with our heart and see how do we feel towards that lion?
Grateful.
That's wonderful. So if you could feel that gratefulness and just send it in the lion's direction, let that vibration just catch and see how that lion responds to that gratefulness that you're giving it. What do you notice?
It's like resting, like um it's just okay, I'll just use this analogy. So my cat, we have a cat. I found it, rescued a cat. And every morning she gets up and she gets on my chest and she just sits there and purrs. It's like giving me Reiki. It's like I'm allowing her to be near me, but I'm not afraid of her. I guess it is a her. You're right. I guess it is a her. So it's like that. Like I'm not afraid of her, but I know she'll whoop some ass.
What would you like to say? What would you like to say to this lion?
I would like to just thank her. Yeah.
Do you feel like she's able to hear that and respond to it?
Yeah. Like an energy, like she's gonna let me in. Does that make sense? But she doesn't let everyone in.
Maybe just you could tell her, communicate how appreciative we
Okay.
are that she's letting us in and she's letting you in. And your job right now, as you kind of move towards the lioness, just notice how she's feeling, how she's showing up in your body. I feel so much love, within you towards her. So just let her keep feeling that and just see how is that lioness responding.
Like rolling over and let me rub her stomach. Like the most vulnerable, like it's all good. And
Now
Mhm.
I'm gonna try something for the audience, but
Yeah,
let's see if how the lioness feels with this.
okay.
If you could ask the lioness,
Mhm.
would it be okay if I talk to her directly? Or would she rather me talk to you and you communicate it to the lion?
Yeah, we're people. We're open to all forms of healing. So yeah, go ahead.
Cool. Okay, so this is called direct access. So
Okay.
I'm talking to the lion. And lion, how would you like me to address you? As a lion, lioness, or is there another name that you would like me to use?
Yeah, that's fine.
Lion?
Yeah,
All right, Lion, thank you so much for being here. And it's such a pleasure to talk with you. I'm curious, what is your job? What is your job inside of Kathy?
yeah. It's to keep all the negativity out and the people that aren't here for her highest and greatest good so they don't get to her center core. So it's like the picture behind you, like she's the flames on the outside, but like they don't get access to that circle, that heart, right? So like to keep all the people away. And she has a big tribe, right? So,
Yeah, yeah. It sounds like a very important job that you do, and it sounds like you're really good at that job.
okay.
Let me ask you this.
Yeah.
What would happen if somebody did get in? Some energy or something came in that was not great. What do you fear would happen?
Hmm. Well, she's recovered from it before, and she's always been able to come back. So I'm not afraid that it's gonna like destroy her, but I just know that some wounds, we're afraid that it'll wound her, so it'll take more time for the healer to heal it.
Hmm.
Like the other part will have more work depending on the type of energy, right?
Yeah, so it sounds like things have happened in the past
Yeah,
that have gotten through you that have been very hurtful to Kathy,
yeah.
and your job is to make sure that that doesn't happen again. Or am I hearing that correct? I don't want to just
Yes,
tell you what
but
your
also
job is.
like
Is
it's a more
that?
of a discernment too. Like it's not every negative experience in the past that we make sure doesn't happen again. It can, some of them are like, okay, I can handle this too. So it's like another part, like a wisdom part too, that's like, it's okay if you learn this lesson again because you have the tools now. So it's not every threat, I guess, but it's just the ones that I feel like I need help with.
Does it feel okay? Would you be able to share, like, what are those ones that you feel you need to be there for to not allow to get through?
Oh, wow. Whew. Um,
We're getting deep. So we could check in too and see, does it feel okay? Are there any other parts that are kind of coming in and saying, wait a minute, this is a podcast. Let's, check in with your system and see if this is okay to continue. What we're doing right now is getting deep, also just getting to understand really this part, this lion part, and really kind of have an appreciation, a deep appreciation for what is the job? What is it that they're really tasked to do? And to really just understand that role.
that protect you from the takers, from the people who want your energy but don't give and receive it back, right?
Yeah.
It's like, in Aladdin where he goes down the market and he steals all the, the coins and the apples and everything. Like no one's gonna upset my apple cart. Like I'm the protected one. If he comes to steal my cart, like the lion's gonna be like, no. Right. And so it's like that. It's like, but also like the
Yeah.
discerning part of like, it's all right if he takes an apple, maybe he's hungry. Right. So it's kind of like a discerning part too, where it's like, oh, there's more like people that'll bring you pain.
How would people bring you pain? Like I understand taking an apple, but it doesn't sound like it's necessarily taking an apple.
Yeah.
What what is this lion most afraid of? Like what is when it says it doesn't want somebody and ask it. Don't think of it, but just ask the lion and see how the lion responds. And if the lion doesn't want to respond, that's okay. But I'm curious if the lion wants to go there, what is it that this lion really does not want to allow in your system that's going to cause you pain?
Um, I guess it's like trickery, if that makes sense, of like things that show up that don't appear how they are. Like anything that's gonna affect my vulnerability. That's not going to appreciate it, I guess. And so it's like if you're not gonna see me and feel like I matter to you, then it's like you're not coming through the gates.
Mm. So we could stop here,
Yeah.
but if we were working together and doing IFS, this is where in this moment I feel an exile just popped her head up.
Okay.
Where a little exile who feels vulnerable, a little Kathy, a child, and we could just, I could ask you more questions, and we could figure out what age it is and how old it is. But there's this little girl
Yeah.
that's saying, "I feel vulnerable." And I feel like, I could believe and be taken away by somebody else and what they think, or if they're being tricksters, or if they're trying to manipulate me. And it feels, and I'm guessing, right? I could ask you more questions and this kind of work could go on and on in a beautiful way. I feel that it seems to me that this lion is really protecting this little girl.
Wow. Yeah.
And IFS would really appreciate that lion. It would encourage you to see if the lion wants you to spend some time with it throughout the week, to get to know it better, to just allow the lioness, the lion, to know she is not alone. She has you there. And then when the lion feels safe, to allow us to actually see the little girl and to see the girl as to why does she feel vulnerable, or what is that hurt, what is that memory? And when you combine IFS with EMDR,
Yeah.
if this girl is holding on to some trauma, we can now do EMDR with even the standard protocol with this little girl
Mm-hmm.
and help her relieve whatever it is that she's holding.
This is so powerful.
So to answer your question, um, that's IFS. That's what parts are. Parts are a normal part of all of us. And when you really get to know them, they're very individual and they're really beautiful and
Yeah.
they're really cool. And they each have a reason why they're there. And so if we're getting burned out, to look and to see how are our parts feeling with that burned out, and we kind of went a little bit off on this protector, but again, if we had more time, we could kind of turn it back to, how do we relate this to you feeling burned out, and what parts are coming up to protect you perhaps from feeling burned out, or what parts are causing the burnout,
Yeah.
and to start to really understand them, sit with them. And most of the work, there's definitely EMDR there and healing, and I love that part. And there's also, I think, an element of the work where, with the healing, as the healing comes, you're helping all of these parts relate to one another in kinder ways. So the reason why it's called internal family systems is not because it has something to do with our families, but it's creating a family with all of these parts that are inside of us and really helping all of them see all the other parts and working together.
Well, I just want to thank you for your magic sprinkling there.
My my
I
pleasure.
I have a very courageous part that's like, I'm down.
Beautiful.
You have some awesome parts inside of you. You
Mhm.
know, to get to know the healer part seems quite a powerful energy. And yeah, I think ultimately we allow the parts to guide us wherever they want. But if we are struggling with something, whether it's self-care, whether it's something in our life that keeps popping up, it is, I think, in the IFS view, it's because parts are working, overworking, and trying really hard to correct something. Sometimes they're stuck in the past, sometimes they're fighting with one another, but it's a map of how to understand why we're suffering right now in this moment.
Mhm. This has really been very incredible. And Kathy, I salute you. You just such a beautiful display of openness and curiosity and willing to share yourself in such an incredible way. And thank you, David, for taking care of her the way you did and being gentle, and allowing the folks in our listening audience to look and to witness what counseling with care looks like. And you have that, David, and it's so incredible. And so we want to hear from you before we have to surrender everybody into their Friday. That, David, if you had any words of wisdom to leave with our listening audience, what would you say to them today?
Come to the summit.
Come to the summit, folks. Get some
Word of
more of
wisdom.
this. Mhm.
Uh, I would say, you know, be gentle with yourself. Um, you know, I try really hard not to be judgmental, to be accepting, to be compassionate. And those are ways that we could treat one another, treat people, also treat inside the people that are inside of us or the parts that are inside of us. And it's really my wisdom is to continue your message that you both have said is that to give people the message, you're not alone. And whatever you're going through, you're not unhealable. You're not broken. There's nothing wrong with you. This
Mm,
world is kind of messed up in my mind these days. And I think this is the way our bodies are responding to the situations that are around us. And you never have to feel, you know, shame, guilt. If you did something wrong, there's a way to correct it. Um, there's a way to repair whatever it is that we did do. And so this is really a call to people to know that there's communities out there and there's ways to find more healing and don't give up on yourself. You're worth it.
yes. And then, David, where can we find you? Can you share your website with the folks so that if they want to reach out, they'll be able to look you up?
Sure, please. Open invitation. Um, my website is www.empoweredthroughcompassion.com. And yeah, definitely reach out. I'd be happy to answer any questions or just share more. And you could
Beautiful.
find me at the summit.
Yes, come to the summit. Kathy, go ahead on. I'm going to pass this mic
Okay.
on over to
All
you.
right.
Take us out.
All right. We appreciate all that was said, heard, and expressed here in this divine time on our podcast today. We thank all the people that have shown up to hear it. We bless you all. We thank you, David, to be our honored guest, Tamera to be my co-facilitator or friend. And just go into your Friday with a lot of gratitude. Take care of your parts with kindness and compassion. If you enjoy this, give us a like and share. And we will see you at the summit, which you can find in the link at the end. All right. Take care, everyone.